I'm Kevin Gilgy, and I'm with Compassion Washington. I'm here to do this videotape to show how to process instruments after we have seen patients. We're going to just imagine that we have seen a patient and we have a dirty tray. The tray would normally have a plastic cover sleeve over it. And I'm going to open up, now these are sterile instruments, and these happen to be hygiene instruments, but all of our instruments are contained in stainless steel trays. There's a large one like this for hygiene, and then there's a smaller one that's half this size, which contains the ultrasonic tip and the handpiece, so that those don't go through the ultrasonic. These go through the ultrasonic. So if I had just finished treating a patient and I have dirty instruments here, first thing I would ask you is that at the unit you wipe any blood that you happen to see, any major blood or anything, because this is going to go into the ultrasonic, which will take care of it. But if there happens to be a lot of blood or anything on the instrument, if you wipe that off. And then what really helps us is if you put these in order, and I just want to demonstrate that because these are all oriented with little strips like this. And so if I start right over here, we have our mirror, and mirror goes here, and probe. But anyway, then all the other instruments start to line up. It's like a little puzzle. But if you get these lined up for sterilization, it really helps that station, like so. And then once they're lined up, close it up and place it into this, into the appropriate bin, how they are to be lined up within the cassette. And so you come to your, what's called the hygiene tray box, and it's shown in this photo, and these instruments are shown in proper alignment. So if they're in proper alignment, it makes life a whole lot easier for sterilization. By the way, before you get started, we have a garbage can here to put all your disposables. Once your cassettes are stored, come down here, take the sleeve off, throw it in the garbage here, spray down your tray. We will have some wipes on top of this, some Optum wipes. Here I don't have them here, but just your standard Optum wipes, and wipe the tray. Grab a sleeve off of here and put the tray in the sleeve. At that point you set it here, take off your gloves, put on some over gloves. Your regular gloves will be at the end of the run here. My hands are very big, so I can hardly fit in these. And so if I'm doing hygiene, I would grab the hygiene instrument cassette and a hygiene, we call it hygiene no ultrasonic kit, because we want to stress to everybody that we don't want those to go in the ultrasonic because it'll ruin the handpieces. And then we slide along here. If you're doing restorative, you have a restorative 1, and these are all restorative 1 cassettes if you're doing standard restorative. And we have restorative 2, which contains the hand pieces. Those are all full-size cassettes because there's more things that are not sent through the ultrasonic. As you slide along here, if you happen to be seeing a patient for surgery, everything for surgery is in a large bag like that. So as we move along here, we have a selection of upper forceps, lower forceps, elevators, and all sorts of different miscellaneous. Your provider will tell you what is needed, and oftentimes send you back to this bin for whatever else you might need. If you need a surgical handpiece, a 45-degree handpiece, they're in this bin. And then as we come along here, these are refills of everything that you'll find in your cart. So any of those boxes that you see in the cart, these are refills. If you composites, there's tips, there's cements, and everything that you might need. So we're sliding past all of this. We have surgical burrs. We have everything here. This is sterile water and 412 syringes. These are rubber dam kits. And then here, if you are running out of 2x2s or 4x4s in your cart, you can resupply right here. And then here's where you would pick out gloves of your needed size for your for both you and your doctor or provider. Extra bibs, masks, suctions, prophy angles. And here's a key item. If you're missing anything, you don't know where to find it. This book has everything that we have in the clinic in it. It's all alphabetized, and it says where it is. If we were to need, for instance, carbocaine, we would find it on the dental restorative cart, typically in the third drawer in the green divider. If we needed carbocaine in the surgical cart, we'd find it in the second drawer in the green box. If we did not find any in those locations, then in this final line, we can see that it would be in the blue number 11 bin. And so how that works is the blue number 11 bin would be over on the wall. All of our supplies are on carts and they're color coded. We see the blue, this happens to be the blue, that is the green cart. And blue number 11, you can see on the second shelf there, number 11, that contains all the refills for anesthetics. You can do that for any item that you see in the whole clinic. We have extras for everything. We have extra hand pieces, we have extra surgical kits, we have extra instruments of every design. So, and if you happen to be doing something such as a stainless steel crown, we have stainless steel crown kits here. We have ultrasonic units here. We have pretty much everything you could possibly need. So it's a system, and once you get started in the day, you'll find that it's a real simple system to understand. And if you have any questions, we have people all around the clinic that can help you figure out just where to find things. It's all cross-referenced and it's all in that red book, so you should be lacking for nothing, I hope. If you are lacking for something, I would greatly appreciate that you let us know. In other words, we will have a clipboard that says how can we improve, and that'll be at the end of this table. And if you see something that you think, this clinic is great, we could improve this, and give us a note, because we like to hear from our providers, because we want to keep this clinic state of the art as best we can, given that we set up on Friday and we take down on Saturday. It's a one day thing. It's helpful to have everything streamlined. I really appreciate your help. Thank you so much for volunteering out there.